So I've just seen, a few patients within the same visit with the pain that they've had for a year or more be able to sit in positions that were exclusively off the table for them just by starting to work in some different ways of sitting and then going back to how they originally wanted to sit. So, a little breakdown of how you can do this at home yourself is you're going to start by sitting in whatever position it is that is kind of aggravating for you. So maybe that is kind of like that tilted back position where you are more on your tailbone. Or maybe it is just actually sitting with more of an anterior or a forward pelvic tilt, but you still can't tolerate that. So I want you to get into that position. I want you to make a mental note of, how much pain you're in that position. So 0 being no pain, 10 being the worst pain imaginable. Okay, we'll say it's a 7 out of 10 in this position. So how can we start to build a different movement pattern that's going to get your brain to connect a little bit differently to that area so that you're not getting that nervous system override to be an inappropriate response? So you can do it in a whole bunch of different ways. You just have to find a way of sitting that is similar to the painful posture, but is different enough that it's not painful. So again, with one client that I had, it was as simple as, okay, I'm going to have you sit on this chair and I'm going to have you start to do just some pelvic tilts. All right, so you're just going to go up and down from the tilts for 30 seconds. Okay, cool. How does that feel? You're looking for a change. So whether that's your pain increased or whether that's your pain decreased when you go back into that original sitting painful position. And so if your pain increased, that means that you have got to find a little bit of a different position because now we're just ramping up the system. But if your pain decreased when you went back and tried the normal sitting again, then that means you're on the right track. So then when you do that, you are going to go back to, again, the pelvic tilts. Again, we're just using this as an example. And now I'm going to have you just, again, add something a little different. So then maybe bring your leg out to the side and bring it in. So pelvic tilt, bring your leg out to the side, bring it in, right? Again, when you're doing the movement that's trying to kind of reset the system, it's important for you to make sure the movement is not painful. Because if it's painful or if it's very painful, then you're just reinforcing to your nervous system that, like, hey, yes, I still need to protect this area because I'm doing something that's causing the pain right now. So the real key component is finding a modification where you don't have pain anymore, but is some sort of active movement that is similar to the posture or position that creates pain, but is not the same completely. And you want to retest. How do you know something's working? You have to test it at its baseline, then you have to retest it afterwards. So when you do your retesting, if it's more painful, then that means you've got to find a different modification that is not painful while you're doing it. If it's less painful, that means you're on the right track. Continue to add some changes to what you're doing and continue to retest until you're not having any more pain in the sitting position. So movement is a great way to try to help reset that system so that you get normal, basically, protection responses only when you need them, not when you're doing things that are everyday things. So you can also use other things to help reset the system, but this is something really easy that you can do yourself.